Hello, I'm Alexa Wilkinson, and I will be your host today for this presentation on the ICD-10 PCS code structure. In this presentation, we will cover the following key areas: the format of the PCS code structure, the number of characters in the PCS code, details of these characters, chapters in the PCS codebook, and how a coder uses a PCS code manual to build the appropriate ICD-10 PCS code using a real-world scenario. Purpose, structure, and format of ICD-10 PCS. The ICD-10 PCS code system is a procedural classification published for use in the United States for reporting inpatient procedures. The structure of the PCS codebook is designed to be highly detailed and specific, providing a comprehensive framework for documenting medical procedures. The PCS code is alphanumeric and consists of 7 characters. Each character in the code provides specific information about the procedure, making the code highly descriptive. The structure is consistent and each character position or axis of classification has a specific meaning. This uniform structure helps in maintaining precision and clarity in documenting medical procedures. Each of these characters play a crucial role in identifying and detailing the procedure being performed. The 7 characters are section, body system, route operation, body part, approach, device, and qualifier. Together, these characters provide all necessary information about the procedure, from the section of the system being addressed to any device used and additional qualifiers that may further specify the procedure. Also, character values may be the numbers 0 through 9 and the letter A through 0, except I or O, because they can be confused with 1 and 0. So a coder will never code the letters I or O. Whew, that was a lot of information. To give you a better explanation of the character values, the first character value is for section, the second character value is for body system, the third character value is for route operation, the fourth character value is for body part, the fifth character value is for the approach, the sixth character value is for the device, and the seventh character value is for the qualifier. A good way to remember this is Sally bought root beer at Dairy Queen. Sally, section, bought, body system, route, route operation, beer, body part, at, approach, dairy, device, queen, qualifier. The first character value represents the section. This character identifies the general type of procedure. It can refer to medical or surgical procedure, imaging procedure, or other types of healthcare intervention. For example, the character value 0 stands for medical and surgical. The character value 2 stands for placement. Oh, and just so you know, guideline A8 states all 7 characters must be specified to be a valid code. If the documentation is incomplete for coding purposes, the physician should be queried for the necessary information. ICD-10 PCS is broken into 3 main sections, and then that are then broken down into 17 other sections. Here I have listed all the sections and their corresponding character values. The most commonly used section is medical and surgical, that has the character value of 0. The second character placement is the body system. This character specifies the body system or anatomical region on which the procedure is performed. In ICD-10 PCS system, there are 31 body systems. Guidelines pertaining to the body system, B2.1a. Procedure code for anatomical region can be used when procedures are performed on a general area rather than a specific body part, or when specific body part information is unavailable. Basically, what that means is if you are coding for something and whether the documentation doesn't necessarily specify what body part it is, or there is not a character value for that particular body part, you can code it to the nearest anatomical region around the body part. Also, code or guideline B2-1B, the term upper and lower in certain body systems indicate anatomical location above and below the diaphragm, respectively, such as upper veins for veins above and lower veins for veins below the diaphragm. Next, we have the third character value, the root operation. It's crucial as it describes the primary intent or objective of the procedure. The best thing you can do to help yourself in PCS coding is to learn your root operations. Coding will be much easier if the coder has a good understanding of root operations. ICD-10 PCS has their own definitions, and as a coder, you must determine what the root operation is based off of that definition. Just so you know, Guideline 3.1a, in order to determine the appropriate root operation, the full definition of the root operation as contained in the PCS tables must be applied. Root operations are broken into 9 groups with a total of 31 different operations. For example, procedures that can be performed only on tubular body parts include bypass, dilation, occlusion, and restriction. Another example is procedures involving cutting or separation only include division and release. Character value number 4. This character identifies the specific part of the body on which the procedure is performed. Each body system has a set of body parts associated with it. For example, in the digestive system, characters could represent the stomach, small intestine, or liver. Guideline A4, almost always certain character values are a combination and dependent upon any preceding value in which it is dependent on. Basically, the body part will depend on what the body system value is. For example, if the body system is nervous system and the body part could be spinal cord. See how they relate? Also, guideline A5, as the system is guideline A5, as the system is expanding to become increasingly detailed over time, more values will depend on preceding values for their meaning. Character value number 5 is the approach. How did the surgeon reach the site of the procedure? There are 7 different approaches listed within the manual. Guideline B5.2 directs a coder to code as an open approach if the procedure is performed using the open approach with percutaneous endoscopic assistance. There are 7 different approaches. Open with a character value of 0, percutaneous with a character value of 3, percutaneous endoscopic with a character value of 4, via natural or artificial opening, character value 7, via natural or artificial opening endoscopic, character value 8, via natural or artificial opening with percutaneous endoscopic assistant, character value F, and external, which is character value X. The 6th character value is for a device, and this is a device that will remain in place after a procedure. Devices are broken into 4 main groups: graft, stents, prosthetics, implants, and drainage devices. If no device is used, this character is typically represented by 0. Guideline B6.1a. The device is only coded if it remains after the procedure. Also, Guideline B6.1b. Things that are considered integral to the performance are not coded separately. Materials such as sutures or temporary post-op wound drains are not reported separately when it is a basic integral part of a procedure. And last but not least, the seventh character value, the qualifier. This provides additional information about a procedure so it can further be specified. The qualifier can indicate things like diagnostic versus therapeutic, or specific attributes like the type of tissue transplanted. If no qualifier is applicable, this character is represented by the default code or the default character value of V. These are some of the chapters inside the ICD-10 PCS code system. Things that are important to keep in mind are that the medical and surgical chapter are the largest chapter and most used. The administrative chapter is crucial for documenting therapeutic and diagnostic administration. And don't forget about the measurement and monitoring chapter, where this chapter will be used for things such as blood pressure and temperature and such.
A 62-year-old male presented into the emergency department with severe pain in the right leg, which has been worsening over the past few days. He has a history of peripheral artery disease and is a long-time smoker. Upon examination, the physician noted diminished pulse in the right femur artery and significant pallor in the right foot, indicating possible artery occlusion. Treatment decision. Given the severity of the stenosis and the patient's symptoms, a decision is made to perform an open surgery procedure to dilate the right femoral artery. The goal of this intervention is to restore adequate blood flow and alleviate pain while preventing further complications such as potential amputation. Surgical process. The patient is taken to the operating room where he receives general anesthesia. The surgeon makes an incision in the groin area to access the right femoral artery directly. After carefully dissecting through layers of tissue, the surgeon identifies and isolates the affected segment of the artery. Using appropriate surgical instruments, including balloon catheter, the surgeon performs an angioplasty by inflating a balloon within the narrowed section of the femoral artery. This dilation process helps widen the artery and improve blood flow. Once satisfied with the results, any necessary stents may be applied to maintain vessel patency. After ensuring homeostasis control of bleeding, the surgeon closes up the layer of tissue and skin using sutures or staples. The patient is then moved to receive monitoring. The patient is then moved to recovery for monitoring. ICD-10 PCS code 047K0ZZ. 0 indicates that it's a medical surgical procedure. 47 specifies that it pertains to procedures on arteries. K denotes dilation. 0 signifies that it was performed on a specific body part, the right femoral artery. And ZZ indicates that no device was used during this procedure and there is no qualifier.